of actually starting our next cycle and thinking ahead of getting out our surveys and stuff for our next community health needs assessment 3-year cycle. And we're right in the heat of our action plans for our last cycle. So we'll be addressing some of those things today. And what's really exciting is that this may be our last virtual meeting for a while. Our next one we're going to do in person, and I've never met many of you in person, so I really look forward to that in September. So with that, I'll pass it back to Derek.
Awesome. Thank you, Dr. Lynch. Appreciate that. Yeah, I get a little sneak peek that our September meeting will be in person, and we'll talk a little bit more about that as well. But appreciate everybody being here this morning. I know we have a really exciting, jam-packed agenda filled with updates that I know I'm excited to learn about as well, and lots of opportunity as well for discussion and conversation. So with that, we can jump to the next slide, which is introducing Lisa and I think some other guests potentially as well, sharing an update on our MOVE Community Council. So with that, Lisa, I'll pass it over to you.
Hey, Derek, I'm going to try and get my screen going here. As you noted, or you said, I'm Lisa Morris Helmstetler. I work with Olmsted County Administration. I've been with the county maybe 12, 13 years, and I have another almost 10 years with another county prior to that. So lots of county work. I'm getting my screen ready here, maybe. And we've got John Edmonds here too. I also saw Zenny is here. I'm not sure who else from our group is here, but I have a list of folks for you to see at the end of this. I'm just going to check with John Edmonds, our DEI coordinator, to see if he wanted to run through these or if he'd like me to take them.
Why don't you take them, Lisa?
Okay, all right. So on this first slide, I need to give a little bit of explanation about. You see the term community council, but then you also see mobilizing Olmsted voices, maybe, there we go, for equity or MOVE. So this is a really exciting initiative for those of us who've been working on it for years now. And what happened is our staff team started calling this initiative Community Council maybe 4 or 5 years ago, and that kind of stuck. And so that's how a lot of people started to learn and hear about it, was as Community Council. However, it now is a community council that has a name, and that name is Mobilizing Olmsted Voices for Equity, or MOVE. And so if you hear community council or you hear MOVE, that is one and the same, and I just want to make sure everybody is aware of that. Okay, so this is a collaboration between the Public Health SHIP team, so the Statewide Health Improvement Partnership, the Joint Study of Racism as a Public Health Issue, and the One Olmsted Group, which is the Olmsted County Diversity, Equity, and Inclusion Initiative. Please note the SHIP graphic is very incorrect. That's why I made sure to say Statewide Health Improvement Program or Partnership, because it is not an actual ship in the water. Okay, so I'm not going to go through everything on this slide. I'm trying to keep it pretty high level today and pretty brief. However, this slide illustrates how some of this work, the history behind this work and the partnerships involved. So you can see there were county board resolutions being passed, and then you can see below that what the One Olmsted Diversity, Equity, and Inclusion Group was working on, where public health and the SHIP team specifically were reimagining what their community leadership team would look like, and that's a mandated group that they have to have for their SHIP grant. And then the joint study work, which went on for a little over 2 years, and how that also has come to impact is that one of the over 40 recommendations that they had was to have a group that had community members involved in monitoring our progress and the implementation of those recommendations. So what's important to see is that gray box kind of over on the right, where you see all of these things are kind of coming together, and we were realizing that the community council really could be the place for all of this work. And then you'll see over on the far right, the olive green rectangle, which says design team. And what this is where we really started the work. The design team is a community group of 9 community members and 5 Olmsted County staff. And so we all came together so that the community really could design the structure and the process around the community council. And I will talk about that a little bit more here in a moment. I'm just showing you this briefly. I'm not going to read it to you because I think it's important to understand that this work really ties into one of the Olmsted County goals that we have this year, and that's community trust and engagement. So really trying to think about how we engage community, how we develop trust, and how we collaborate and really hear from folks and utilize their lived experience to help guide us in our programs and services. Okay, what is MOVE? This is really hard for me to be quick and succinct about this, but I'm going to try. So it's a group of diverse community members who each represent a different community within Olmsted County. We call the members of MOVE community connectors because that's really what they're doing. They're connecting community and county. They're sharing lived experiences from community with the county, and the county on the flip side can come in and say, hey, we're thinking about this new program or a new change, and we're wondering what you think. How do you think this would be received? Is it needed? Do we have the right plan here? So really, these folks are a little bit different than our standing advisory groups in that they're expected to engage the communities they represent, because we're looking for more than one opinion. We would like much more of a group opinion. So not just one individual's lived experience, but hopefully many. Our initial focus is going to be on public health related topics. I don't think that's a surprise to anyone, and we have hopes to expand that in the future. And again, just because I think it's important, I want to note that it's a two-way communication loop between the county and the community. Okay, so I mentioned the design team, our fabulous 9 community members. Zenny is one of them, and she's here, so that's great. These are the things that they accomplished. So we all started working together in January of 2023 and met every other Friday all the way through April of 2024 for 2 hours each time. And that does not count the homework and the research that they did outside of those meetings. This is a really dedicated group. So what they did is they researched. First, they did a lot of research just to see what other jurisdictions were doing, if they had anything, a similar model to what we were looking at with community council. They designed a work plan, defined community, and I just want to stop at this point. Defining community sounds so easy, but this group really dug in. It wasn't just about looking at demographics. It was so much deeper than that, and it was a really well thought out and lengthy conversation that spanned over the course of multiple meetings. They determined the community council mission, vision, out of scope activities, a prioritization process. They figured out what the membership and alternates would look like, determined roles and responsibilities, the meeting structure, reporting structure, and now the engagement and recruitment plans. So what's next? There's a lot of things happening right now. We're super excited. We're continuing, like today, to highlight MOVE to the community and to our own staff. And we continue with having great support from United Way and Rochester Area Foundation in lunch and learn opportunities and the planning of other community informational sessions. In addition, we've got social media from Olmsted County. We have brochures. They should be here any day. We have a one-pager with a QR code for folks who want to apply, and I'll make sure that each of you get that. So applications are being submitted. We've already received a number of applications. We've been setting dates and times to start interviewing folks at the end of this month. That interview panel does consist of folks from public health, from what was the joint study, and from the design team. And we're not going to close the application process because at this point, we're not sure how long it will take to build a full, if you will, group. And so we're going to keep that open. I would still, encourage people to apply now, but there's not a deadline, so folks can continue to apply. And then once we have the connectors and we have that group set, we're going to start with a really comprehensive education plan. So we're going to provide IAP2 training, which is the community engagement framework that the county is using, diversity, equity, and inclusion work, facilitation training, and team building for the community connectors. Okay, that was a lot, very quickly. Just before you ask questions, just wanted to note that we have two different emails listed here. They both go to the same account, either one is fine to use. And then I also really want to share the support team from Olmsted County on here. John Edmonds, who is here today. I'm not sure if Caitlin Barrientos from Child and Family Services is here. Muse Abdi from Public Health, or Shakita Phillips from Public Health, but these folks have been the ones supporting the community design team and been behind the scenes really making sure that we keep moving this work forward. And I can't see the chat, so if there are questions, let me know.
This is Alan. I'd like to ask a question in terms of, it sounds like there'll be training for the coordinator, what do you call it?
The connectors,
the
yes.
connector, yeah. I always, seems like the connector really represent a node so that the connector can connect to their representative communities. Is that kind of a thought process? Almost like a hub and then a node. The node is self-distribute information to, or you can call it connector. But my question really is that you mentioned there'd be training being conducted, and when would that be started? And do you need to gather all the 50 connectors, or do you conceive of starting, when you have certain number of people already signed up?
That is a great question, Al. We've been having that conversation quite a bit. We don't know what the magic number is yet, but we are not going to wait until we have, like you said, 20 people, if that's what we're looking for. We're going to try and get started prior to that, because one of the things we were very intentional with when putting all the framework together with this group was that we didn't have to have a quorum, right? We don't need to have so many people there to be able to have a meeting, if you will, because we recognized that it's a lofty goal, right? I mean, there are countless different folks with different identities that we're looking for. So we will get started, and that training process will be whatever that magic number is, when we say, okay, we've got 10, right? Let's get going. And then besides that training portion, anybody else who comes in will also get that training. It just probably won't all be with the rest of the group at that point, since some of them will already have been through it. The team building, however, and some of that DEI education we think is important to continue kind of having throughout, because this group is going to have to understand and know a lot about each other, and they're really going to need to come together. So I hope that answered your question, but some of it is still a bit unknown.
Sure.
We're watching the applications come in, we're keeping track of who it looks like we might have represented and who we don't. But again, we don't want to hold out and wait too long, right, for it to look perfect, if you will. We want to progress over perfection, right? So we're going to get started here when we feel like we have enough of a group.
May I ask
I
another?
just want to,
Sorry, go ahead, John.
yeah, I just want to add another comment to that. I think to your question, Al, the reason we chose connector as the sort of name of who these folks are was intentional. And we want to emphasize the fact that we're connecting folks to their cohort, their respective cohorts in the community, but we're also connecting the community to the county, and so that sense of connection, collaboration, etc., is very key to what we're trying to accomplish here. So the design team actually said, okay, so this is who we want to call these people. We want to call them connectors. We just put an exclamation point on that idea.
Yeah, another question I have is you mentioned IAP2. This I guess I've heard from my own group people, CMRC, I represent community mobilization. At least one of our members know about IAP2. So can you say a few more words about that? And
Yeah, so I had some slides on that too I can share with you, Al, but it's really a spectrum of community engagement, right? There's 5 different levels, and there's a lot of ways in which you can engage depending on what it is you're trying to accomplish, right? So An example would be, like maybe it's something where you send out a survey, right? But then there's other things that you're going to want to maybe have a listening session, or you're going to want community to partner in helping make a decision. So it really depends on what you're looking for as to which type of community engagement you identify as being appropriate, but it's a wide range. And I'm happy to, Al, to share some of that with you. We have a slide in the slide deck that I just didn't share today that really kind of outlines that nicely.
Yeah, okay, thank you.
Mhm.
Thanks, Lisa. So you answered Sue's question in the chat about how long the connectors roles are for, so 2 to 3 years. Any other questions for our guest here this morning?
Eric, I sent over the slides, so those can be shared, and there are a lot of other slides in the slide deck, so feel free to look at those. There's a lot of detail there. And I'll also send Mary Claire our one pager, which has the QR code for folks who want to apply, and you can distribute that however you would like. We would appreciate that.
Perfect, absolutely. We will do that.
Thank
Awesome. Thank you so much, Lisa and John and Zenny, for being here. And I remember just thinking back a few years ago, the kind of some of the initial conversations to where it's been today and where Move is at. So it's just really exciting to see and hear all the hard work that you and others have done kind of come to fruition. So awesome job. And yeah, absolutely. We'll send out those materials after. Awesome. So shifting gears here, also really excited that pretty recently the team that I'm housed within public health was able to add Michaela Morris, who they're an intern and will be working on a lot of the LGBTQ plus work that not only Olmsted County in Olmsted County Public Health, but also looking at all of the other teams, so like the Community Coalition for Integration and others and all of their efforts. So before we jump in, sorry, I saw someone's hand was raised, but if you have any questions or anything, can chat those in. But I'll pass it over to Michaela, who they'll be talking about, and then we'll be having some small group conversations here about the LGBTQ plus work and some resource wayfinding. So Michaela, I'll toss it to you.
Hi, thank you for that introduction, Derek. As mentioned, I'm Michaela. I use they, them pronouns, and I'm the Olmsted County Public Health PMQIA intern for this summer. And I'm going to be presenting on the resource wayfinding. If we can just go to the next slide real quick. All right, awesome. So just as kind of a level set, though most of you probably already are familiar with it, the Community Health Improvement Plan, or CHIP, is kind of a health prioritization that happens every 3 years. And for the 2024 to 2026 CHIP, the priorities were access to care, mental health, and drug use. So for each of those, a data profile is created to identify significant disparities, and for the 2024 to 2026, non-heterosexual adults were among the top 3 disparities across all priorities. This included things like higher rates of mental health disorders, substance abuse, financial stress, and to address these disparities, a community co-design project was formed. In October of 2022, the CHAPP process secured a grant from UCare to focus on health equity work. And with that, in January of 2023, they contracted with Culture of Health by Design to conduct a community co-design project to better understand healthcare for LGBTQ plus Olmsted County residents. For anyone who's unfamiliar, the co-design approach involves co-designers from the impacted communities, in this case the LGBTQ plus community, who act as conduits to difficult to reach community networks, which are essentially their inner circle. So that could be friends, families, neighbors, anyone you kind of talk to on a daily basis. This allows for a broader, more diverse collection of perspectives that aren't always seen through other methods. With this specific co-design, there were 5 different co-designers, which I got the honor to be one of them, that met 4 different times with the project team to discuss interview topics. And then in between those meetings, they went out into the community, had those interviews and discussions with their inner circle, and came back to discuss solutions. This process took about 6 weeks in total. From that co-design project, there were 3 central recommendations. The first was the LGBTQIA+ healthcare navigator, the second being the healthcare team education on compassionate LGBTQIA+ care provision, and the third being LGBTQIA+ resource wayfinding. So I know you guys already heard a little bit about this in the last meeting, so I'll just do some kind of brief updates. The title kind of lends itself to what the position is, but the healthcare navigator position is being worked on and is currently being looked at to have a second co-design project that specifically narrows the scope and centers on the design for this position. They are currently seeking LGBTQIA+ community members to act as co-designers, so please feel free to share this form with anyone. The QR code goes directly to an application for anyone interested. As for the compassionate care provision, the team did a lot of great work on training prototyping beginning in March of this year, and currently that prototyping is being finalized with the help of a graphic designer, so it should be more available to the public soon. And finally, LGBTQIA+ resource wayfinding is kind of the central part of my internship this summer, so I'll be spearheading that initiative. This was an Olmsted County Public Health collective impact contribution for access to care. The LGBTQIA+ resource hub will be built into the Credible Mind platform, which we will get to in just a second. And the list will focus centrally on local health resources for the LGBTQIA+ community, but may expand to non-health resources and non-local resources as well. Another priority is to identify gaps in available resources in Olmsted County. Right, for anyone who's unaware, Credible Mind is a community resource that promotes health and wellness in a personalized manner. Our Olmsted County Public Health is teaming with Credible Mind to make the platform accessible and free to the public community. The LGBTQIA+ resource list will be linked through the Credible Mind set through a company called Find Help in the Community Resource tab of Credible Mind. So Find Help is a separate company from Credible Mind, but can be linked within their platform. It can get a little bit confusing, but if you look on the right here, at the top there's the Credible Mind platform. You can navigate to the tab Community Resources, scroll down a bit, and then there's Find Help. Find Help is a website that connects people with community resources, especially those that are at no or reduced cost to the public. They do take suggestions for resources on this site, so the public can submit their own resources that they find useful. And each resource is thoroughly vetted by members of their company, so everything's very credible. It's also reviewed on a near daily basis. So much of my work will be adding new programs and also curating that list specific to LGBTQIA+ health in Olmsted County. With the resource wayfinding process, I'm currently in the midst of identifying local resources. So this has involved a lot of connecting with community leaders, utilizing digital databases, and making myself available for community input, among other things. We've also been working on building up the resource site itself. So this is a collaboration with Find Help to create that page that's specifically for LGBTQIA+ resources in Olmsted County. Once that's completed and filled out, we will be sharing this work to the community. We have the honor to work with the Olmsted County Public Health Credible Mind team to share this resource out. They're already doing a lot of great work in presenting Credible Mind, working on social media, and a lot of that outreach work. So it's great to be able to collaborate with them. Once that's all kind of completed, we will be working on observing outcomes and integrating any feedback we get from the public or from collaborators like you. All right, now we're going to have some time to explore, find help, and brainstorm some resources. So there is the Credible Mind platform. I'm also going to throw it in the chat real quick. So please feel free to navigate to that and then open under the Community Resources tab the Find Help page and look around there as well. Once you've gotten a few minutes to look around, please brainstorm with your breakout group any LGBTQIA+ resources that you think would be helpful to be added to this list. If none in your group can think of any, please feel free to discuss resources that are already on the Find Help page. And also, please have one person from your group write down any ideas you come up with, either resources that you think of or resources that you already discussed that were already on Find Help, and we will use that for a Menti board afterward. And with that, I will hand it over to the breakout rooms. Please feel free to join back in whenever this discussion kind of dies down, and I believe after 15 minutes we'll go in and grab you if you haven't already joined. So, thank you.
Before we jump into the breakout rooms, any questions for Michaela about process or anything? All right, awesome. In the resources tab, once you open that, link's right on the top of the page there. So yeah, if you have any questions, let us know. We're here to help. And I opened up the room, so hopefully you'll be sent there soon. We'll come back at 8:10.
Hello, everyone.
Hello. Hi.
I can't hear you, Al. I think you're muted.
That's right. I'm muted. Yeah. Okay. Hello. Yeah.
There you are.
Mhm.
Thank you. Good morning. Good morning, all.
Good morning.
Good
Should we
morning.
do some introductions quick?
Sure. Go ahead. Go ahead, Brian. You can start.
All right, yeah. Brian Lynch, pediatrician at Mayo Clinic, and just I'm also part of the LGBTQIA work group.
Nice.
So really excited that we get to have this discussion here. Pass it on to Al.
Yeah, Alan, I think or OpenBeam, which is really a technology company that sort of share information out. And also I represent the Community Mobilization Group, which is really a gathering of BIPOC groups so that they can amplify our voices.
Sure. Beautiful. Awesome. My name is Ansa Cobb. I work for the Policy Analysis and Communications team at Olmsted County. So I work for the county. I'm specifically a management analyst. So I work with a lot of data analysts for diverse communities, like gathering and reporting that information that we get outside of public health. And I have this connection to public health as well because I'm a master's of public health. So even though we don't work with health data specifically at HAPP is what we call ourselves, I still always have this love and connection for public health. So I try to stay to help as best as I can in those groups that I'm in. Oh, and I forgot to mention, we also help with that mobilizing Olmsted Voices for Equity design team move. Yep, a teammate and I help with creating the goals and measures for that group, and that was great. Oh, and also connecting previous year's work. So because they used to be called the design team. We also just connected with how did the previous years go? How can this new team do better? What were successes? What were some things to change? So that was really good to do as well. So really proud of them.
So are we supposed?
Right.
Sorry, go ahead. Dr. Lin?
Yeah, I thought in the chat we were gonna have that link, but I don't have it in my chat right now.
Oh,
Did either of you keep it from before so we could open up and look at the site?
I will pass it on. I think I have it here. Is it it's the Credible Mind with Michaela, right?
I actually have it too. So
There we go. I sent
So I
it
don't know
over
if
to you.
Are you
if it's
sh-
easiest just to share, Al, if you wanna do that. if
I
you wanna
guess I
look at
could.
that.
Yeah, I suppose I can find the. Okay,
Thank
there.
you.
Yeah. Oh, let's see. There you go. Okay. Can you see my screen? Yeah.
Yes.
So I guess I'm looking at the home screen, and um, and then you have. And I don't know how you wanted to. How do we want to talk about this? I actually have wandered into there from time to time, but I still haven't really totally gotten used to it yet. I suppose.
Sure.
So so almost looks like if you go down here a little bit, right? So these are the find help, right? You can go to find help
Um,
places where, as was mentioned, that you could find. In fact, you go here, and I think so that takes you to the next facility, which is to find help. And find help, and I'm actually quite familiar with it too. Is that you can now go and figure out. Like I think you can do some typing to figure out what and find out what resource available.
mhm.
Okay, for community health services, and you can type. Yeah, there's a you can type kind of thing like find zip code, and if you want to look for housing, I guess you can go here and see see how does it go, housing
Oh,
advice, housing residential, okay, that kind of thing. So what else do we health? Okay, let's look at health here, huh? And then you can say that end of life care, which is something I get worried about once in a while. And so this is what's on the information base, the database that says these are facilities out there that can deal with the
yeah.
particular issue. Yeah. And in fact, this was something that I actually learned about Find Help, well, even 3 or 4 years ago already. I think Mayo Clinic was the first one that really wanted to populate this database. My question had always is actually the way that it seems to work was that organizations can become a member of Find Help, and then they can actually enter information directly
Mhm.
into this database of themselves. The question I had was I sort of heard a little bit from presenter that there's a curation process. So my question really was, because sometimes you get worried about information get entered may not be the most accurate one, maybe even
Mhm.
not even good intention too, I suppose, right? So, what
Mhm.
is the curation to ensure that there's safety and protection guardrail for this information? That had been my question I was going to ask.
Yeah, I don't know the answer to that, Al. I mean,
Hmm.
I know that Mayo was working with Find Help and we met with, sort of leaders of that. I assume they are the people who are the caretakers, the people who, from the organization, but I don't know what process they have. I only have sort of higher
Yeah.
level meetings with them. I don't have like the day-to-day meetings that, we're using at Mayo Clinic for our social determinants of health screening referrals.
Right.
So it's a great
Mhm.
question. I
So,
could certainly ask that the next time I get together with them, which is usually about once a month.
Hmm. Yeah, because in fact, several years ago when it was first introduced, the community, I actually became a member, and I just went in there to just play around with it. I might even sign up as at my entity, Open Beam. So it seems I got accepted too already. So the question really again is, what is the checkpoint to see that you're a credible, organization to enter information, right? I'm sure
Yeah,
there
I'll
may
check on
be.
that.
Yeah, there may be. So just that, is a question.
But I think we're supposed to look at the LGBTQIA plus to see
Yeah.
what resources are listed
Okay.
there to see if we know any gaps.
And I'm not sure how to get there though. Is there topics? Okay, is the topics here? Mental health. Uh, uh, are we sure that it's already implemented, or is this being considered to be put in here?
I was assuming implement it because they mentioned there's a number
Okay.
of sites there and then see
So
if there's to add, but I don't see it so far. I don't know if it'd be under healthy relationships,
under
maybe.
health relationship, romantic
Yep,
relationships, parenting. Okay, there you go. LGBTQIA. There you go. All right. So navigating to this could, I guess it could. It takes a little bit of doing to get to this point, isn't it?
Mhm.
Maybe. And what? So how? What do you want to see? For example, I guess you can personalize something. A profile, I suppose. Right? If you sign in, and join, you can personalize your.
maybe we can just scroll down briefly and look at
Okay,
what organizations are listed here right now or what information and,
right. But I don't think the organization is listed here, though, Dr. Lin, because I think this organization is probably in the find help. Right? This is more like resource, right? I think.
yeah,
Yeah.
I think you're right.
Yeah.
Oh, here we go, maybe.
Oh, there's something down here. Okay, there's so links to mental health. That they're reducing stigma. These are all knowledge, kind of how.
Those are great.
Mhm.
Yeah.
It looks like under the resources, there's an arrow you can see more than the 5 they have listed. Maybe we can look at some of those.
There's it, this thing here. You mean learn
No,
more?
right here, the one next to the Southeast Regional Crisis
Oh,
Center,
this
it's
one
got a little
here.
arrow. Yeah, I
This
wonder if
area.
that
Yeah.
adds
Okay.
more there.
You just basically there you go. They could click into Mayo Clinic.
Okay,
Yeah.
yeah, it looks like a pretty,
Crisis. So I guess this listed the resources that deal with the topic. Right? Yeah. What was it? Was it helpful? Not yet. Okay, so that's that. Anything
yeah,
else you want to look at?
I wanted to make sure they had that clinic from Mayo, but they already have that there.
Okay.
The Mayo Clinic one, that transgender and intersex specialty
Mhm.
clinic.
Yeah, it'd be nice how to determine the order of presentation, right? If you have to go, it, it'd be nice if we can kind of make some of the more useful ones more pronounced, I guess, rather than having to scroll down in here to find it, because if you could miss this.
Mhm.
Now, this could be the role of the curator, I suppose, to determine which the order of prominence being displayed. In fact, I would think myself personally, I don't really like this scrolling thing. I would like them to just list it out here, in one shot. If there's empty space here, they could actually make it bigger too. Seems like rather than having to scroll and to find it.
Yeah, I think that's a great suggestion.
Yeah, a lot of white space here. Well, at least on this screen. Maybe they did it because of other device. And I have a relatively big screen. I don't. So anything else you want to take a look? So we have that. I think this is probably the most important part. Probably I would think, right? Resources. My personally is if you want to investigate knowledge and things like that, it's almost like different layers of information. There are people that really need help right away, right? And there are those that are doing research for maybe for practitioners into that area. They want to know what kind of knowledge you can gather. So there's different audiences, I think, don't you think? That if somebody just going to come in here and I want to get some information about how I can get help. So it seems like there may be some design here that can tailor to the audience, the user centric.
Mm.
Um, so if I want to know what events are out there, where will I find it? Like for example, in a kind of celebration for a prime event or whatever, will I be able to find it here? taking pride in yourself and your well-being. These are all knowledge, I guess. Tips for parents.
Mhm.
Mm.
There's a lot
And,
of great information, but Al, when
mhm.
you said more user friendly for the reader, are you saying something that's more intuitive with choosing what's subject within a subject? Like, I'm just curious if you're saying for you, if you want
Yeah,
more like this subject to be able to choose something more within here rather than having to read through them all.
right.
Even though at the top, the top while you're scrolling, the top has LGBTQA taking pride in yourself and your well-being. Below that, there's another big subject bolded, and then it keeps going. Just curious, like what you mean by further further changing things.
In my other IT career at IBM, we have this notion about depending your role, right? If you say if you are, it'd be nice to have a kind of audience specific area to navigate. If you're a researcher, you click it, you find these things. If you're somebody that may be encountering some situation that you got to deal with, so different. You define the audiences or very clearly. If you're a parent, there's some navigation hidden right on top here, right? You're a parent, you click it here, then you bring up all the
Oh,
parent information. If you're
right.
LGBT plus kind of a um, person, then you can
Yeah,
click that. That would be nice, right?
rather than scrolling
Yeah, rather than
down.
scrolling,
Okay. Yeah.
more
Okay.
audience space, right?
Mm-hmm.
I don't know if this platform allows for that, to be honest. It's almost like
Right.
but it's very rich, obviously. A lot of
Mhm.
things here. I suppose you can. I don't know if you can do kind of make it a hotspot or something. If you can put it in your website and say what link, put a link. If you like this particular area, you can link it up with something. I don't know. So, anything else that you guys want to take? There's as maybe personalization, maybe personal, maybe the place you do
Yeah,
something. I
click a couple of
guess.
those.
I think that
Yeah.
probably require you to log in, right, to personalize it.
Yeah. Do you want
Yeah.
to click a couple just to see what happens?
Okay. But what you want to see?
Let's go with podcast. Sure,
A
let's go with
podcast?
those.
Okay.
And then can you go to LGBTQ? You can touch LGBTQIA plus. On the corner, it says other filters.
Other on the corner where?
So if you go back to filters, down,
Oh, okay.
right there.
Here. Yeah. Actually,
And then, yeah, see what happens. And you can put done. And then I think one popped up.
okay. Immediate help contact.
You go down. Okay, that's what came out. I think it's that one. And the nothing more, I think.
So now you got the navigation is still kind of challenging, isn't it? What do you, at least for me.
Mhm.
What else you want to take a look?
I'm curious if you just think like there's too much going on the screen for you, if you'd prefer just the topics and less
Yeah.
happening.
Mm-hmm.
I understand why there's, the Olmsted County Community Resources on one end, the top home to community resources tabs, and then you can choose to filter um, for LGBTQIA
Right.
plus. I understand what's happening. It's not too much for my eyes. I'm curious, yeah, if you want to say more, Al or Brian, what you're thinking.
It seems like maybe that the role of some kind of navigator or somebody that I guess that would be a role, right? Almost kind of going to hire somebody to do something. Maybe that good person can help people design their personalization profile, help them navigate this, so they can how edit their interests and all that. That might help to get into this place quicker,
Okay.
I guess. Right.
How the whole navigation.
I get you.
I guess we're back.
Welcome back, everybody. Pass it back to Michaela to keep walking us through and allow y'all to share some resources.
Yeah, thank you, everybody. Now, with that kind of brainstorming session, I hope you all had some good conversations and were able to find everything all right. Some of you might have noticed it can be kind of hard sometimes to try and find specifically LGBTQ plus resources specific to Olmsted County in that site, even though it is a great resource. So um, all the more need for a more direct line to that. But now we're going to move on to a Menti board. So there's going to be a form that whoever wrote down the resources or anyone who wants to can fill out and just put in whatever resources you guys discussed, whether that was new ones that you thought of or ones that were already on Find Help. And then we'll open it up for discussion after that. Also on the Menti form, there is a Q&A section. If anyone wants to put questions in there, we'll be able to answer them. Thank you, guys. I forgot to mention as well, feel free to put in as many resources as you want. I think it's an unlimited number. So if your group discussed multiple things, you don't have to pick a favorite. Just put in whatever you would like or whatever was discussed.
Haley is a good point, and Michaela, I know you'll be kind of taking this information and moving it forward. Yeah, absolutely, as you said in the chat, or Michaela, if you have any questions or anything that you want to dive deeper on, if you on any of these resources, we can ask that the folks in the particular room share a little bit more about.
Absolutely. Sorry, I'm not super familiar with Menti. I'm not sure if there's like a word cap or anything. So I apologize if that's getting in the way, but yeah, feel free to share in the chat or unmute if you have something that you'd like to share. In addition, at the end, my email is going to be available and in a QR code. So if anyone wants to directly contact me, that will be available as well. But yeah, I think right now I'm just gonna open it up to any discussion people want to have, or questions anyone has. Right now for me, the first thing I'm just kind of noticing with this is how kind of diverse an array we have here. I think it's lovely to see, everything from like dental services to the library to, Planned Parenthood. These are all really great resources that I think should be discussed more and that a lot of people don't know about. So I really love to see how wide an array we have. And if anyone has anything else they'd like to discuss at the moment or type in the chat, feel free.
Michaela, this is Sue from Mayo. In our group, we just discussed how there's a lot of great organizations that might have, programming within their organization that might be listable that doesn't change too often because, there might be a limited number of organizations just working on this focusedly, but many organizations that have programs and outreach and are doing more so as the need is better known and understood. Thanks.
Absolutely, that's a great point. Thank you. All right. Well, if no one else has any questions or comments or anything, I believe there's a slide on the presentation, like I said, that has my email, and I thoroughly welcome any ideas, connections, or questions anyone has. So please feel free to reach out with any of those. And thank you all for your time and efforts.
Awesome, fantastic job, Michaela, and thank you so much for leading us through this conversation and for you all. A lot of great ideas, it seemed like, kind of circulating and being shared in your group, so that is awesome to see. So thank you all for kind of kickstarting that resource wayfinding piece. All right, so I know Dr. Lynch mentioned earlier, and we can jump to the next slide, that the September HAPP meeting will be in person. So when I send out the minutes and all of that next week, I'll also be updating the meeting invite to the actual location versus TBD, which we had before or currently have. So it'll be 2100 Campus Drive Southeast, Rochester. So that's the Olmsted County Public Health Services building, or the 2100 building, or whatever you're most familiar with. I'll have the address there, and we'll share more info to come closer to that meeting. However, since we're pretty much 3 months out now before that meeting, we would love the opportunity to co-create an agenda with you all. So hopefully you kept Mentimeter up. Otherwise, you can jump back in, or the Teams chat and speaking verbally are also options as well. But this next slide here will just have a question of what do you want to talk about at the September in-person HAPP meeting, knowing that it'll be, of course, in person and a lot of conversation and opportunity for dialogue and discussion. So just wanting to get any thoughts that you have, again, in Menti or in chat, or if you have any verbal thoughts that you want to share as well of anything in particular chat related that you want to talk about at our September in-person meeting. So I'll pause and let you all share your thoughts. Give it another minute or so for anybody else who wants to share anything that they'd like to talk about in the fall. Excellent. Well, it looks like a lot of great ideas and potential conversation points in September. So when you see that agenda, you'll definitely see these sort of topics and things talked about during those meetings. So during that meeting, so hopefully kind of get you excited as well of hopefully being able to attend that September in-person meeting as well. And like I mentioned, we'll send some more information as we get through the summer and as we get closer to the fall and being able to, looking forward to being able to come together as a group and have some good conversation and camaraderie and all that stuff. So thank you all for sharing your ideas. So our next conversation here is our CHAP satisfaction survey. We can go to the next slide. So this month last week, I satisfaction survey that you're probably getting used to this time of year. And so that satisfaction survey is pretty brief. It's like 10 or 15 questions and just ask about the chat process in general. It is available now through the end of the month. So you have another few weeks to complete that. And feedback is provided. And of course, the feedback provided is really important to making improvements in the chat process. So just noting a couple of examples from last year, allowing us to identify new partners to reach out to for the chat process and improve the measurable impact that we make on the community health priorities. For example, that collective impact approach that we're piloting over the next few years. So time dependent, we do have a little bit of time here to spend on the survey, and Mary Claire just dropped it in the chat there for you all. So if you haven't already, if you're willing to spend a couple minutes here to at least start that survey, and if you have already completed it, you're good to go. You'll have a little bit of a breather here, and I think we'll just round up here and we'll come back as a group at 8:40. So again, if you haven't already taken the survey, it's in there in the chat there for you. And if you have, then you're good to go, and we'll see you. We'll see everybody back here in a few minutes. right, well, we'll bring everybody back now, but appreciate the time for completing that and working on that, and I look forward to sharing what comes of it in terms of next steps and continuous improvement opportunities at a future HAPP meeting. And with that, we'll jump to our core agency updates and then our community announcements. So starting with Mayo.
Yeah, this is Brian. I can do our core agency update for Mayo Clinic. A couple of things. Mayo Clinic's currently in the next few months will be remodeling its entrances to the east side of the Gonda and Mayo buildings to provide a temporary front door to the downtown campus during the construction process. And certainly, this is kind of our exciting news is the expansion, and I'll put in the link, kind of a site if you want more information about that. Also want to report that Mayo contributed more than $900,000 in the second quarter of 2024 to different community efforts. And lastly, I just wanted to talk about a little bit of our collective impact strategies we're doing in Mayo. Currently, kind of some overview things, we're trying to reduce waiting times for initial mental health appointments. We're trying to increase referrals for social determinants of health and primary care using Find Help. And then we're really working to educate medical providers about appropriate use of opioids, and also trying to increase screening for substance use in our adolescents. So those are some highlights of some of the projects that we're doing.
Awesome. Thank you, Dr. Lynch. We'll pass it over to OMC.
Hi, this is Terry. I'll be doing our update today for the mental health pieces. In October, we started doing nurse visits for our folks that are seen in our psychiatry and psychology department to give extra additional care and touch points. We started an outreach clinic at the Northwest Clinic every afternoon where we have a psychiatrist or psychologist out at the Northwest Clinic. We're implementing in-person group therapy in September. And those will take referrals from Psych, Southeast Family Medicine, and Southeast Internal Medicine. And in the fall, we'll be implementing nurse visits for sleep insomnia. And we're starting to have clinicians meeting with our active aging services patients. And we are also providing psychotherapy to UMR students on a monthly basis. For the drug use impact, we were able to add an additional FTE in January of this year. We still have approximately 200 patients that are still seeking treatment in our MAC clinic, which is our medication assisted therapy clinic. So we're still looking at FTEs for that. Participating in outreach events, excuse me, the Substance Use Community Forum, the OCPH and Opioid Core Group, Safe City Nights. We're working on an alcohol and drug counseling program. We have a grant through MDH to help support this current activities and expand our support. We have a Towns grant tackling overdose with networks. We're outreaching to primary clinics, such as our branch clinics in our surrounding communities. And then we also have a partnership with the Adult Detention Center to offer MAT, so medication assisted therapy to incarcerated individuals. And then as far as access to care, we have a collaborative grant with Family Services in Rochester, which provides assistance with caregivers for patients who have dementia. The coordinator who attends these appointments and then meets with caregivers to match them with community resources, respite care, et cetera, to help them care for their loved ones at home. We've added standard language to patient messages to educate them on our virtual care options. We've got a campaign for this summer for increased access options for vaccinations. We're hoping to do another drive-through for back-to-school vaccines, and we're also providing on-site nursing home vaccinations. We're reviewing our scheduling options with care areas to ensure patients can schedule when and how they want, so patient-centric schedules. We're working on getting more and more scheduling tickets available so people can schedule their appointments when they want them via their MyChart. And then we also have a STI HIV community work group, and we're doing some outreach and testing at various community events. So that is the update from OMC.
Excellent. Thank you, Terry.
Mm-hmm.
And I know our folks at Public Health are at meetings and vacation, so they asked that I share some updates on behalf of Olmsted County Public Health. So if you have any questions on these, I'm happy to take them and direct them to the folks that are working on these initiatives. So first is Know the Dangers campaign. This is with the opioid settlement dollars that Olmsted County received about a year ago, I think, and it's essentially a community education campaign directed around opioid use. So it should be available any day now. So be on the lookout for that in social media. There's a website and all kinds of great tools for that campaign. Another update that they have is around cannabis, and the county board this month and next month are taking a look at a first reading for the cannabis zoning and ordinance update. No votes happening this month, with a final vote looking, it sounds like they're saying July. Olmsted County is looking at number of cannabis dispensaries that they're able to allow, with a minimum being 13. It sounds like they'll be close to that, just wanting to learn and get their feet wet for a reason with starting small with that. And then they also wanted to note with that that the establishments will be limited in terms of they have to be a certain feet away from youth serving places such as like parks and schools and childcare and things like that. So I'm sure more that public health colleagues can share more on that cannabis work moving forward. And then lastly, they wanted to note that one of their public health programs, WIC, which stands for Women, Infants, and Children, is one of the few counties in the state piloting online shopping for their WIC program with Hy-Vee. So a pretty exciting initiative there. And with that, we'll open it up for everyone. Any community announcements from your positions or roles or your various boards and committees? Anybody have any announcements they'd like to share verbally, or of course you're welcome in the chat as well.
Hi, this is Beth Kangas from Zumbro Valley Medical Society, and our street medicine program is doing an eye care clinic on June 29th. I'll put the flyer in the chat. So we're doing comprehensive eye exams with dilation with our ophthalmologist, as well as giving out no cost prescription eyeglasses. We work with the foundation to provide new glasses. And that will be June 29th, Saturday at Christ United Methodist Church from 1 to 4. Thank you.
Thanks for sharing, Al and Beth. Any other announcements that anybody wants to share? right. Well, if anybody thinks of anything over the next day or so, let me know and we can include that in the message that's sent out to everyone early next week with the minutes and the flyers and the recruitment for move and all of those different things. But thanks again for being here this morning, and looking forward to our next in-person discussion in September. Have a great Thursday, everyone.
Thanks, bye.